Amy has an emotional problem she wants help with. Imagine these two scenarios. Scenario 1. Amy consults her GP, who refers her to a local clinic. She is assessed, offered an appointment, and her therapy begins about 12 weeks after she first sought help. This is known as help provided at the point of availability. Scenario 2. Amy goes to a walk-in clinic, completes a brief form, and sees a therapist 30 minutes later. This is known as help provided at the point of need. Help provided at the point of need is delivered by a way of working with clients known as single-session therapy, which can be accessed by walk-in or by appointment. Single-session therapy occurs when the therapist and client meet with the agreed intention of addressing the client's problem in one session, so that the client can move forward on their own. However, it is also agreed that more sessions are available to the client if needed. Single-session therapy is a way of delivering therapy services which is based on 3 main points. 1. Across the world, the most frequent number of sessions clients have is 1, followed by 2, followed by 3, etc. 2. 70 to 80% of clients who attend for one session are satisfied with the session given their current circumstances. 3. Therapists are poor at predicting who will attend for one session and who will attend for more. Single-session therapy is best integrated with other services within a therapy agency. One way of doing this is to offer everyone who needs help an immediately available single session. Those who need additional help or a different service can have it, but, where appropriate, everybody is encouraged to engage in a 5-stage process before seeking another session. First, they reflect on what they learned from the session. Second, they digest this learning. Third, they act on the learning. Fourth, they let time pass. And finally, they decide if they need another session. In single-session therapy, the therapist does the following. First, they help the client to identify past attempts to solve the problem, encouraging them to build on what was helpful and cast aside what was not helpful. Second, they encourage the client to identify and use their inner strengths and resiliency factors while addressing their problem. Third, they encourage the client to identify and use external resources such as supportive people in their environment while addressing the problem. During the session itself, the therapist works with the client to identify the best available solution to the problem. The client is encouraged to rehearse the solution in the session before drawing up an action plan to implement the solution. At the end of the session, the therapist reminds the client that more help is available if needed.